The newest innovation in healthcare may be the hospital itself. One medical center near Detroit is so different, we asked our travel editor to check it out. Peter Greenberg, good morning.
And good morning, Gail. You know, traditionally hospitals were designed as a place for medical professionals to just do their job. The hospitals weren't often built with patients in mind. But that is not the case at one hospital that looks and feels like a luxury hotel and treats you like a valued guest. It's lunchtime at the Henry Ford Hospital in West Bloomfield, Michigan. But don't look for day-old Jell-O served on a fiberglass tray at this cafeteria. Here, it's a restaurant with a menu comprised of fresh and healthy food, much of which is grown on site in their own greenhouse. What are you growing here?
Well, actually, you know, this is fresh basil.
Nancy Schlichting is CEO of the Henry Ford Health System. Her goal was to build a new kind of hospital, one that would become a go-to destination, a place people actually wanted to be. Do you know anybody who's excited to go to the hospital?
No. You know, it's not a place that on Friday night we say, oh, let's go to the ER. You know, it just is not a place people want to come to. So to be, you know, a place for healing, true healing, it has to be different.
Schlichting recognized that hospitals needed an image makeover. But she took a leap of faith by hiring an executive from Ritz-Carlton to design and then run the $360 million facility. But there was one rule.
The rule is it's about the patient.
But you don't wake up patients between...
No, we don't wake them up between 10 at night and 5 in the morning.
Unless you have to.
Unless we have to.
The focus on patients begins immediately. Arriving guests are greeted by wheelchair valets in a lobby rivaling the world's finest hotels. They pass by a spa, the hair salon, and designer gift shops as they travel through an enclosed atrium to their private room.
This is a typical patient room.
Dr. Mark Rosenblum heads the hospital's neurosurgery department. He says the patient-focused approach helps speed healing times.
Any patient's family can stay here anytime, night or day. It is important for patients' well-being and recovery to see their loved ones, to be less in a stark, uncomfortable, unusual environment. We think it helps.
The luxury accommodations don't mask the hospital's main purpose. In rooms like this, surgeons perform hundreds of different procedures each week, all on state-of-the-art equipment. Adrienne Lenhoff had a life-threatening tumor removed last year.
Doctors that I'd seen before were alarmist. They got me very scared about things. Here, they were very matter-of-fact. They made me feel very, very comfortable with whatever the outcome was.
At this hospital, they're averaging about 50 surgeries a day. But the other key is the aftercare, unlike anything most of you have ever experienced. Corrine Backman's aftercare began after back surgery. During her recovery, she was introduced to yoga. Now she comes back 4 times a week to exercise, dine, and meet with friends.
The care is just incredible. Plus it has, you know, this wonderful restaurant, and it doesn't feel like a hospital.
Schlichting says the costs of luxury are offset by low readmissions and higher rates of recovery. Of the hospital's 192 rooms, each is booked.
Our goal is always to have the most efficient, high-quality care so that a lot of people will come, and it'll make it, you know, a very cost-effective model for the industry.
As the restaurant gets busy for the next meal service, the sense of community it's created becomes all too clear.
You know, they figured out when to come, and they don't usually come when the staff is here getting their lunch, but they come for lunch.
Can you even find Jell-O on the menu?
I have not seen Jell-O on the menu here. I suppose if someone asked, I'm sure we would accommodate it.
Well, not only will they make you Jell-O if you want, they'll bring it right to your room, because at the Henry Ford Hospital, you know what they call it?
What?
Room service.
That
and they
already
do it
makes
24/7.
Wow.
Just the fact that they have Jell-O. But I think any hospital that's taking advice from Ritz-Carlton is my kind of place if you have to go to
I
the
am
hospital.
shocked to hear that.
But how are they able to do this, Peter, without additional costs? That's what I don't
Well,
get.
they built the luxury accommodations into the original design. It wasn't an afterthought. And when you have low readmission rates and higher rates of recovery, you can keep the cost down. In fact, we did a cost comparison. For chest procedures, they're 1/3 the cost of other hospitals, and for hip procedures, less than 1/3 the cost.
Oh.
And by the way, you're paying for a private room at the same price that you pay for a semi-private room at another hospital.
Let's hope it catches on.
I feel like I just want to go and hang out there, just like hang out in the hallways.
There's room at the yoga class.
Let it catch on.
Thank you, Peter Greenberg. Thanks. Beer.